I came to Optimal Spine a couple of months ago because I had been suffering from headaches consistently for on and off for a few months. Um, I knew that chiropractic care would hopefully resolve some of these issues. So I sit at a desk for a long period of my day, and I know that that has contributed to probably some of the pain that I'm having. And since I've been here, I've had, a huge success of, I guess, the reduction of the pain that I have in my neck and also just general health. The exercises that I have been given to that I have to do at home are keeping me accountable for my progress and making sure that I don't continually have more pain. I've definitely seen a huge reduction of the pain since taking on some of those things. I now have a new pillow and I have the little, I guess it's the foam roller thing that I stick under my neck, the
The
adjustment,
D-roll?
the D roll,
Yeah.
which is a good way to end the day. A bit of meditation while I'm lying on the floor doing those exercises. It's a really friendly group of people here. I come a few times a week and everyone's smiling and laughing and having a good time while also enjoying some what feels a little bit like a contortionist activity upstairs, but it's a part of the journey and I feel great afterwards. So I'm sort of just taking each of the steps. So, but yeah, I still work at a desk, but I am trying to get more mobile during my day and standing up at a standing desk and including things like that to make sure that I'm having an optimal spinal health.
So this is an example of the importance of not just coming in for an adjustment and then go home. In my humble opinion, that model does not work for people that have a sedentary job. When you sit at a computer all day or you work on a mobile or tablet, your body will be under stress. So coming for care, changing your posture, a big element of that is changing your habit and being prepared to do exercises at home. So here we hear a patient who changed the way she works, the way she does exercises in the evening, and that's the only way to get sustainable results. Otherwise, the treatment will just be a temporary solution,
Yeah, for
and
sure.
your problem is back again. So it's a real 50-50 between the patient and us as practitioners and a clinic to make sure we get long-term solutions. Big breath in and out. And again, big breath in and out. Good. On your back, please. Hand tilting here. And you just relax there, relax. Good. And then the other one. Well done. Good. Please go upstairs and do your traction. So here we have the loss of lordosis, but we also have loss of thoracic kyphosis. So it basically means that the mid-spine has flattened out and the neck has lost its curve as well. So here we are introducing a force that causes the neck to go into more curve and the thoracic spine to start building that curve. So this is one of the most difficult reconstruction stimulations that there is, because you need to get the thoracic spine set up in a way that it literally falls into a curve again and the neck comes back at the same time. If you only work on the neck in a patient like this, you actually create a bigger thoracic problem. That is why it's important with the initial examination to know 100% what is the entire spinal presentation. Otherwise, you think you are dealing with one problem, in this case, a headache that is most likely caused from a lack of cervical curvature, but you actually end up making the thoracic spine worse. That's why full spine evaluation initially is so important in these kind of patients. Now we're getting a head harness being put on in order to create a force, so we get force over time to regenerate that cervical curve that we have lost. And the head harness is being loaded with weight. So we are pushing the patient's thoracic spine into the curve. We're using a D-roll and we are loading the weight onto the neck. And of course, this kind of traction initially starts with a couple of minutes, and then we gradually load in more and more as the body accepts it and as the ligaments gets that flexibility and change of position. And combined with the home exercises, you then get a permanent change.